Hello, my name is Dr. Victoria McDonald, a concierge pharmacist, and I want to welcome you to the Mom No Coffee Needed Summit. I created this summit because I am passionate about empowering moms and helping to guide moms on their path to wellness. So, which is why I have invited Dr. Felice Gersh today to help speak to us on different ways we can address our hormones and how our hormones impact our life. Now, Dr. Gersh, could you give a brief introduction about yourself?
Sure. It's a pleasure to join you. So
Thank you.
I am a little bit of a unique breed. I am what I label an integrative OBGYN. So I'm board certified in obstetrics and gynecology, and I also did the 2-year fellowship in integrative medicine at the University of Arizona School of Medicine, and then became one of the first board certified OBGYNs in that new field of integrative medicine. So what that means is for my patients, I have what I label an expanded therapeutic toolbox from which I can draw all kinds of therapeutic modalities to help my women patients to optimize their health. So in addition to pharmaceuticals and surgical procedures, I am very well versed in herbal medicine, nutraceuticals, giving micronutrients, and so on. And also, we do a lot of lifestyle medicine. So mind-body practices, biofeedback, guided meditation, body work, and fitness, and lots on nutrition. And I also am a fasting expert, which can really play a big role in helping women to reestablish metabolic health.
Wow, that is such an expansive toolbox that you have that you can just pull from all these different areas. And I love how like you do have that traditional practice, but it's not just about, shoving pills down people's throats or using that as your only tool. So looking at deep root causes or looking at alternatives to prescription medications, that's amazing that you value that so much. So great. Thank you. I'm so excited to have you on today. Now, something I really wanted to address is really like the relationship between our hormones and maybe our mental state, how we deal with stress and how we deal with anxiety and depression. Can you speak a little bit about how when our cycle is in different stages, how that impacts how we're feeling, how our moods go?
Well, it is really fascinating, and everything in the body is multi-directional. So we used to say like bi-directional is multi-directional. So it's like a giant spider web, and everything interlinks with everything. And estrogen that comes from the ovary, which is called estradiol, I label the master of metabolic homeostasis. Now, metabolism is about everything. It's about the creation of energy, the utilization, the storage, and so on of energy. And of course, what organ uses tremendous amounts of energy? The brain and the neurological system in general. So everything in the female body, and this is not really talked about, is designed for optimization of reproductive capability. Now, human women, are the only females in the entire animal species world that actually try to control their reproductive destiny intentionally. I mean, if you went into the wild and there were deer and antelope and lions and monkeys and you name any animal species, fish and octopus, whatever, they don't think, well, this year isn't a good year to have babies. It doesn't work that way. But humans do. They say, I don't really want to have babies right now, and so forth. And so we try to come up with ways to block fertility. The unfortunate thing is that fertility is actually a vital sign of female well-being. And fertility and reproductive functionality is linked to metabolic. Like every organ system is designed to optimally support reproductive success. So once you recognize that and accept that, then you can see how estrogen, and I'm going to use the word estrogen, but what I'm really referring to is the type of estrogen the ovaries make, called estradiol. That particular hormone sort of is like the master of regulating every system in the body, every organ system, every function, all the enzyme systems, the peptides, the fatty acids, all these different systems, communication, including all the neurological system, so that the body is healthy. Because you wouldn't want a female to get pregnant who isn't healthy, because pregnancy is the ultimate stress test of the female body. That's why finally it's recognized in conventional medicine that what happens to a woman during her pregnancy is sort of a foretelling, like fortune telling for the future, what's going to happen as she ages. So pregnancy is really critical for testing the metabolic status of the female. And a woman who, I'll say, fails, it's like a stress test, fails the stress test and develops gestational diabetes, hypertension, preeclampsia, preterm delivery, all these different, lots of miscarriages, and of course, infertility. All of those are unfortunately saying that this woman has some underlying metabolic dysfunction and will probably have some problems as she ages. And once she's in menopause, she's going to be at greater risk for developing high blood pressure and diabetes and heart disease and mood disorders. So mood really is a critical part of being healthy. The brain function and cognitive function, like memory and thinking processes, focus, attention, they're very interconnected to mood issues. I mean, women know if they have moms, unfortunately, because women make up like 2.5 times more of the Alzheimer's patients than men, which relates to their hormones and loss of them after menopause, that women who have Alzheimer's will often have very labile moods. They're often crying, or they get really hysterical or fearful. So the cognition and the mood are really interconnected. So hormones regulate the brain. I mean, so the neurons in the brain are very interconnected to estrogen. There are neurotransmitters that are produced in the brain, like serotonin and oxytocin, which is sort of interlinked between peptide and hormone, just depends on how you look at the number of amino acids in the chain. So these hormones, estrogen in the brain, actually have a big impact on the function of production of these neurotransmitters, the receptor function, the health of the neurons that produce these neurotransmitters, and so on. In addition, acetylcholine. So acetylcholine is another neurotransmitter that's in the brain, but it's also in the peripheral neurological system called the autonomic nervous system that interlinks the brain to all the other organs. The autonomic nervous system is also considered like the automatic nervous system, and it takes care of all the functions we don't think about naturally, like peristalsis. We don't think, now I want my stomach to churn, or sweating, or temperature, or bladder contractions, or, any of the things, like, we don't think about those things, but they're all regulated through the autonomic nervous system. And the Chinese got this right with the yin and the yang, like everything in the body is balanced. So we have in the autonomic nervous system, we have the sympathetic, which is like the stressor response. So when that happens, our blood vessels will constrict, we become more pro-inflammatory, our intestinal system shuts down. So basically we're preparing for like running fast away, or fighting. So we don't need to be digesting if we're trying to run for our lives or fighting. And we want our blood vessels to constrict. So in case we have a laceration and start bleeding, our blood pressure will be maintained so we don't go into hypovolemic shock. The stress response was also pro-inflammatory, so that if we get a cut, a laceration, our blood will clot, our platelets will aggregate, and we'll have clotting. Now, parasympathetic, which is directed by this big finger of the brain, it's called the vagus nerve. That is heavily controlled by the neurotransmitter acetylcholine, which estrogen helps to regulate in a whole host of ways. And the vagus nerve is the parasympathetic, the calming effect. So it causes our blood vessels to dilate. It helps our intestines to now be functioning. It helps you to sleep. It slows your heart rate down, where sympathetic increases your heart rate. After menopause, of course, we have loss of estrogen, but even during the reproductive years, women are different from men. They are more pro-sympathetic, which means what? They're like more stressed. They have faster heartbeat. They are just more prone to like the stress response, the fear response. Unfortunately, women suffer dramatically higher rates of anxiety and depression than do men. And this is very regulated by hormones. Now, if a woman has a lot of inflammation in her body, the inflammation can actually get into her ovaries. And in fact, they've done studies where they take fluid from around the ovaries, the little follicles that have fluid around them, and they find they're filled with immune cells that are pro-inflammatory, like the equivalent of pus cells. They're inside the ovary. Now, when you have an inflamed ovary, you're going to have poorer quality eggs. So that's going to affect fertility. You're going to have more prone to irregular cycles. And the inflammation in the brain can also interfere with the master clock that's in the hypothalamus that regulates the timing of everything, so that all our organs are working in the same time zone. So we get like circadian rhythm dysfunction, and everything is finally regulated also in the brain for appetite regulation. So when you have inflammation, then you have dysregulation of the hormones that also affect knowing when you're hungry and when you're not hungry. So the default is you're just always going to eat. And in the brain, you end up with what's called leptin resistance. So leptin is a little hormone made by fat tissue, also regulated by estrogen, as is adiponectin, another hormone from the fat tissue that regulates fat burning. So all of these things are interrelated to estrogen, which can relate to stress from outside sources as well as inside sources, but also lifestyle choices like sedentary behavior, poor diets, nutritional deficiencies, sleep deficiencies because you're running around in the middle of the night because kids are waking up all night, and so on, which can really create like basically metabolic havoc that affects how all these systems work. So you get appetite dysregulation, circadian rhythm. So you get more like tired in the morning when you should be alert. You get more like alert at night when you should be sleeping. You get the night munchies. You have dysregulated appetite, often leading to things like binge eating disorder. You end up having more palpitations, your heart beats faster. And because you have all this overload with sympathetic, you have poor digestion, you have a lot of gut problems that alters your gut microbiome. You can see where this goes. And then when you don't have the right gut microbiome, you don't make the right metabolic byproducts of fermentation. The food that you eat gets modified by the bacteria in your gut to create these magical properties of little substances called short chain fatty acids, one of which is called butyrate, actually binds to the vagus nerve to make us feel calmer and happier and sleep better. So it's all interlinked, and we can do a lot to make the system more balanced through our lifestyle choices, which can really impact fertility and mood and sleep, digestion. It's amazing what we really can control. But the first step, I always say, the first step in solving a problem is understanding and defining the problem. But you can see it's complex. That's why the conventional medical world, like they just throw their hands up and give women Prozac. I mean, they honestly, they're not going to like go into all of this. It's like, well, you got to work on getting your neurotransmitters right, and you got to work on your gut microbiome and your circadian rhythm and your nutritional status and your fitness and get your sleep right. I mean, it's like they don't want to deal with all of that. Yes, it's complex. We cannot dummy down the amazing complexity, the beautiful complexity of the female body. But we need to understand that our moods, our digestion, our musculoskeletal system, everything in the body intersects with fertility. because everything is replicated, all the enzyme systems, everything is actually replicated amazingly in the reproductive organs and in the peripheral system. And they're all completely linked together. There's no disconnect. We're the ones, doctors and so on, that disconnect and say, well, there's this organ system. And it's, that's what we do in conventional medicine. We have doctors who specialize in one organ and they don't see the big picture. That's ridiculous. You have to see this beautiful web of life in the female body, how all these systems interlink. And unfortunately, when you take a hormonal contraceptive, this is unfortunate. I mean, I'm just telling you the truth, everybody out there, that when you take a hormonal contraceptive that changes your hormones, you're not just changing your fertility, you're changing everything, because these are not human hormones when you deal with hormonal contraceptives, whether it's a patch, a pill, an implantable, an IUD. These are affecting your overall hormonal status. And these hormones are not just about making babies. They're about regulating every system in the body to support fertility. That means your cardiovascular system, your central nervous system, your autonomic nervous system, your musculoskeletal system, your skin, you name it, your kidneys, your lungs, your immune system. Every system is interrelated and controlled by these hormones. And you mentioned like the menstrual cycle. This is a complex and amazing thing. The hormones interact with each other. They're not like just random, like living in separate little worlds. So for example, during the menstrual cycle, and it's really important for women to understand the menstrual cycle, you start out with low estrogen, that's when you're bleeding, and then the estrogen rises, and then it spikes up. And that's what will help trigger ovulation. And then after the estrogen spike, you get luteinizing hormone, LH spike, and that triggers ovulation. And when that happens, you make progesterone as well, and progesterone increases and it plateaus. And if you're not pregnant, it then comes down, the estrogen comes down, and that triggers bleeding. Now, these hormones interact with each other in very complex ways. Estrogen, as it's rising, is actually upregulating or making more functional its own receptors. It also upregulates the receptors for testosterone, for thyroid hormone, and progesterone. Now, when you have the rise in progesterone, it downregulates the receptors, for example, for estrogen. And that's why the lining of the uterus, which is growing under the influence of estrogen, we call it proliferation, it's growing. And then progesterone blocks that and then stops the growth. And then progesterone causes it to like flower. So it gets like, like a tree that grows, then it stops growing, then it fills out with leaves and flowers and fruit. That's what the progesterone does. So there's this amazing interaction. Now, sometimes in some women, that actually has a problem in the brain because estrogen intrinsically is anxiolytic. It lowers anxiety. It works through complex systems involving the neurotransmitters like serotonin, which is often called like the feel-good neurotransmitter, and also another system called the endocannabinoid system, which is a fatty acid system derived from type of fats called omega-6. And that's actually the receptors that cannabis bind to. In fact, that's where they got the name endocannabinoid, endo meaning from within, and cannabinoid meaning that it reacts with cannabis. That's like reverse engineering. First they discovered cannabis, then they discovered our own intrinsic system. But that's all actually controlled by estrogen, and estrogen increases one of the endocannabinoids, anandamide, and that's the same receptor that THC binds to. And anyway, but I'm not advocating you take, cannabis. I just want you to understand that there are plants that actually can interact, like phytoestrogens, like soy and flaxseed and other kinds of plants, red grapes and pomegranates, that actually have these magical ingredients called phytoestrogens that can actually bind to our own receptors and actually trigger very beneficial responses. So the bottom line is that when you downregulate the estrogen receptors in some women, it will trigger more anxiety or mood dysregulation, also known as PMS, premenstrual syndrome. And that's why a lot of times people think, oh, you need more progesterone. But in reality, often what works better is if you give them a little estrogen back, a little bit more estrogen that reduces sort of the mood issues, the anxiety. But progesterone is another really important hormone. It's like the yin yang. They, interact with one another. And progesterone is very anti-inflammatory. It reduces inflammation. And if you think about it, of course it does, because in pregnancy, you don't want your immune system to attack your fetus, right? So it regulates the immune system to be less aggressive, less inflammatory. And that, along with some of the changes that happen with the estrogen, because in pregnancy, the estrogen that's predominant is estriol, that's made by the placenta, and that binds to one receptor called the beta receptor, and beta actually downregulates a different receptor called alpha, which is on the innate immune cells, like the attack animals, so that actually in pregnancy, because of the difference in estrogens produced, it also reduces the inflammatory response, all designed so that our own immune system doesn't kill our fetus, right? But that also puts women who are pregnant at higher risk of problems from infectious pathogens like COVID or the flu or chickenpox and so on. That's why pregnant women have a higher risk of adverse outcomes when they get an infection. It's because the body has to do this compromise with not having the immune system attack and kill our fetus, but having to allow, the immune system to be a little bit less robust in terms of fighting off infections. So it's really important to understand why everything is designed for successful reproduction. And these hormones have amazing actions involving the brain, the mood. And that's why after pregnancy, when these hormones plummet, like they're gone because the placenta is gone, the ovaries are not working again, this loss of hormones will sometimes trigger postpartum depression, because these hormones are critical in the brain. So women won't sleep well, they'll have mood problems. And, and those are women who are also more prone later in life when they go through menopause. After menopause, the average woman doubles her risk of anxiety and depression because of loss of her ovarian hormones. But women who have previous issues, like they've had previous depression, anxiety, PMS that's significant, postpartum depression, their risk after menopause goes up 4 times, 400%. And most doctors don't even pay attention. Perimenopause can start 10 years before menopause. Now, what's the average normal age for menopause? 45 to 55 is considered normal. Between 40 to 45 is considered early menopause. Earlier than 40 is premature. Over 55 is called late. So ladies out there, 45 is considered normal time for menopause, and perimenopause can start a decade earlier. So you could be 35, 36, 37, and already starting to have decrease in your production of hormones, which can trigger more mood disorders and dysregulated gut function and so on. And many of the doctors, they just put all these women on SSRIs, antidepressants, and these are hugely prevalent in these age groups. I mean, it's amazing the high percentage of women who are put on these pharmaceuticals, when really what we can do, what I do, is I do a menstrual mapping. So I see what are their hormones. Even women who have regular cycles can really, it's amazing when I look at actually marking through urine testing exactly what their hormone production is through an entire menstrual cycle, how they have too low of everything. It's related to reduced fertility, of course, it's all interconnected. And then you see, oh my gosh, no wonder they have all these symptoms. They have insufficient hormone production and they're perimenopausal. And we can help women with that through herbal medicine, mind-body medicine, through different biofeedback, meditation. There's a whole host of different mind-body techniques. They don't actually make your age change, but they can actually help the ovaries to work better. There's even supplements that we can give that help to give more life to the ovaries. We do this for women who are maybe late in the game trying to get pregnant, DHEA, which is an anabolic adrenal steroid, can actually help maintain ovarian function. Some magnesium, a little bit of melatonin for women who are trying to get pregnant and their ovarian function is less effective in terms of making babies. They can even now do injections with activated platelets, PRP, because they are promoting healing, just like they do in the skin to like make your skin look younger or build more hair if you inject PRP in the scalp or in the knees, to try to resurrect knee issues. You can actually now, it's expensive, but they can be injected in the ovaries and can actually give the ovaries more life, like help them to come back. Because a lot of times it's not just that they have like fewer eggs, but the eggs themselves are poor quality eggs, and they don't make hormones as well. They also don't make embryos as well. And we can sort of rejuvenate that up to a point. So there's a lot of tools in the expanded integrative toolbox to help women to deal with all of these issues. And, but it's complex. I don't want people to be overwhelmed. Oh my gosh, it's so complex. But, if you get down to the basics, it's like hormones really matter for every organ system in the body. You name it, there are hormone receptors there making things work right. And so we've got to do everything to support our gut, our hormones, our ovaries by lowering inflammation, because I mentioned in the beginning, inflammation gets into the ovaries and impairs their function. And everything that's bad for you increases inflammation, whether it's sedentary lifestyle, endocrine disruptors like plastics in our environment, and flame retardants, and all the heavy metals and all the bad stuff that get into us. And then, of course, sleep and our own stressed out lives. We can also reduce that, and eating, getting all the right micronutrients. There's so many things that we can do, taking targeted supplements that help support our mood, our ovaries.
You are just a wealth of information. I had no idea how intricate the estrogen was in the entire body. The spider web that you were describing is immense. Like, a lot of people just think of estrogen and periods or fertility, and that's it. But it being so interwoven in everything in our body is so, like, just goes to say how important it is, and how we need to be very careful in taking care of our body and doing things to keep our estrogen and our progesterone balanced, so that way they're not getting out of whack and then having that domino effect and causing everything else to be out of whack. If people have more questions about hormone health or how hormones are connected with everything else in the body, how can they get in touch with you? How can they get more information?
Well, I do have an Instagram live, and I also have a YouTube. So I would love for people to come and sign up for those. In addition, I'm an old-fashioned doctor. I'm actually speaking to you from one of my exam rooms in my office. So I see patients one-on-one. I'm still, like I said, an old-fashioned doctor. I believe in doing physical exams. I order all kinds of lab tests and imaging when appropriate. And we have a lot of different modalities in my office to help women to optimize their health. I can also do telemedicine in most cases. So I love seeing patients. And if someone wants to be my patient, that's what I'm here for.
Oh, that's amazing, Dr. Gersh. Thank you so much. And then one last question before we wrap up here. What is one thing that you would recommend our viewers start doing to help their estrogen health stay balanced, or something they can do for their ovaries, something that they can help unleash their healthiest selves to better support themselves?
Well, there's, of course, a million things to do, but I'm going to pick one that people can start to do, because we have a world filled with what are called xenoestrogens. These are chemicals that mimic estrogen, but they're like the evil twin. And these are really horrible for ovarian function. The one that's been researched the most is called BPA, bisphenol A, but it's also evil cousin BPS, and now there's BPF, and these are from hard plastics. So what I want you to do is to keep this chemical reduced. It's actually been tested. Virtually every person, 100% of people have this poisonous chemical in the body. And in pregnancy, it actually concentrates in the fetus. So the levels in the baby are higher than in the mom. So I want you to make every effort, effective immediately, to not have plastic in your life as much as possible. Use stainless steel, use glass. Try to store things. If you have to have a plastic lid, make sure it's cool before you put the plastic lid on. Bring your own mugs when you go to the coffee shop and have them fill your own non-plastic thermos, and this affects kids as well tremendously. So do everything you can to avoid ubiquitous endocrine disruptors, particularly BPA.
And then it's true that BPA stays in our body and we can't really get rid of it once it's in there. Is that right? Or
Well,
is it something that we can remove?
Well, the interesting thing with BPA is that we can get it out reasonably, but as fast as we get it out, more comes in. Basically, when they did random testing, like everyone had it in them. And this is an endocrine disruptor for estrogen, but actually also for testosterone. So it can actually cause women to have more testosterone in their body. It impairs the degradation and elimination of testosterone. This stuff is poison. And we recognize it as a scientific community, but yet it's not being implemented in terms of how we make product. And what these manufacturers do, it's sort of tricky. They'll substitute plastic. Instead of BPA, they'll put in BPS, which is at least as toxic. So if anything is plastic and it says BPA free, it doesn't matter. It's filled with BPS. There's no safe plastic. Okay, I don't care what you see on the label. Plastic is bad for you. And it's really impacting fertility and mood and brain health. These are not little things. So of course, there's a million other things I want you to do. But since I'm giving just one tip, because I know you all know that you should eat and sleep and exercise, so I'm going to go to this one. I want you to take plastic out of your house as much as possible.
All right. Well, thank you so much. And that is a challenge. That's a big one. Just because, like you said, it's so ubiquitous. It's everywhere. If we go to the coffee shop, if we're in our homes, there's the different food packaging. So it really is everywhere, but that's a challenge. So thank you so much for holding us high and letting us know about how dangerous this is, and dangerous for ourselves, but then also for our children. I really have loved having you on here, and I've learned so much throughout all of this. And I want to just say thank you for your time. And audience, thank you so much for watching it and listening. And stay tuned for my next interview because it's going to be awesome.